Welcome to MD Anderson Children's Cancer Hospital. In this video, we'll introduce you to the Children's Cancer Hospital, your healthcare team, available resources, when to seek help for signs and symptoms, and who to call. If you have specific questions or needs related to this education, please ask your doctor or nurse. Located in one of the world's top cancer centers is a special place for young people. MD Anderson Children's Cancer Hospital provides children, teens, and young adults with cancer care tailored to their age, size, and development. We offer hope for the future through our clinical expertise, cutting-edge therapies, and support programs for patients and families. MD Anderson Children's Cancer Hospital has 3 main areas designed just for young people and their families: the Robin Bush Child and Adolescent Clinic, the Pediatric Ambulatory Treatment Center, and the George E. Foreman Pediatric and Adolescent Inpatient Unit. These areas are used for medical treatment, education, recreation, and rest. The Robin Bush Child and Adolescent Center, located on floor 7 near Elevator C, is where patients can go for new patient visits, blood tests, port access, follow-up visits, consults, and urgent sick care. The clinic has 14 exam rooms, a playroom, and a large waiting area. It is named for the young daughter President George H.W. Bush and Barbara Bush lost to leukemia in 1953. The Pediatric Ambulatory Treatment Center, located on floor 9 near Elevator F, offers chemotherapy, other treatments, and infusions. It has 11 private rooms and 1 semi-private room that is equipped with 4 chair bays. The George E. Foreman Pediatric and Adolescent Inpatient Unit, located on floor 9 near Elevator F, is for patients who need to be admitted to the hospital for care. This 35-bed unit includes a protected environment for patients having stem cell transplants and cellular therapy, and 9 intensive care rooms. All of our inpatient rooms are private and designed to accommodate parents and support patients' healing. The unit also has a welcome desk that supports the safety of patients, families, and visitors, along with a dedicated pediatric pharmacy, playroom, teen room, classroom, consult rooms, and laundry facility. Here are some things to expect when your child is admitted to the inpatient unit. Each day, the healthcare team will come to the room to examine your child, review information, such as vital signs and blood test results, and make a plan of care. This is called bedside rounds. We encourage patients and families to participate in bedside rounds. Your child's blood pressure, temperature, heart rate, and breathing rate will be checked regularly. These are called vital signs. Vital signs help the healthcare team know how well or ill your child is. Sometimes, vital signs are checked more often if your child has a fever or needs to get a transfusion. Your child's weight will be closely monitored. Weight loss may mean that your child is not eating or drinking enough. In some cases, your child may gain weight from too much fluid or changes in appetite related to treatment. The dose of your child's medicines may also change if your child's weight goes up or down. Intake means how much fluid your child is taking in by mouth and into their veins. Output means how much fluid your child is putting out, such as urine, vomit, and stool. Intake and output will be measured to keep track of what and how much your child drinks, how much IV fluid your child receives, and how much your child puts out. If you change your child's diaper, do not throw it away until it is weighed. If your child uses the urinal or bedpan, do not flush the urine or stool in the toilet until it is measured. Your child will have blood tests done during treatment. These tests are often done very early in the morning, so the results are ready when the healthcare team makes the plan of care for the day. Visiting hours are from 6 a.m. to 10 p.m. All visitors must check in at the welcome desk and present a valid photo ID. Parents or guardians of patients have the right to choose who may or may not visit. Children under the age of 13 must be accompanied by a parent or adult guardian, and all children must be screened for illness and cleared before visiting a patient. Anyone with a fever, rash, diarrhea, vomiting, or other illness should not visit you or your child. You are part of the team that will take care of your child. Depending on your child's needs, any of the following people may be part of your healthcare team. Physicians are doctors who have completed medical school, residency, and fellowship training, and now specialize in cancer care. Your child's primary care physician directs and supervises their medical care. The attending physician will direct and supervise your child's medical care during their inpatient hospital stay. Fellows are doctors that have completed medical school and residency and are now receiving specialty training. Residents are doctors that have completed medical school and are now receiving more training in a specialty area. This is called residency. Residency lasts from 3 to 7 years. It depends on the specialty. Doctors in the first year are called interns. Advanced practice providers, such as nurse practitioners and physician assistants, have an advanced degree and training and work closely with the doctor to provide care. Registered nurses are trained to care for patients during illness and help patients regain and maintain health. Patient care technicians help with basic care, monitor patient vital signs, and help patients to the restroom. Patient service coordinators answer phones, call lights, and help patients and families on the unit. MD Anderson Children's Cancer Hospital offers the following specialty and supportive care services. Our supportive care team is available to help manage treatment side effects, such as pain. Dietitians with our clinical nutrition department provide help with nutrition needs and plans during treatment and recovery. Occupational and physical therapists help patients maintain or regain physical activity level and the ability to perform activities of daily living. The Integrative Medicine Center offers complementary medicine therapies to help reduce patients' stress and anxiety and improve their physical, mental, and emotional well-being. Our psychiatry and psychology team is trained to help you and your child cope with feelings. Talk with your doctor or nurse if you would like a referral to any of these services. We have a number of other resources available to help you, such as social workers, child life specialists, pediatric education and creative arts, spiritual care, language assistance, patient education, and the Learning Center. Social work can also help you find resources in your community. For a complete list of resources, please refer to your Resources and Services Guide. With cancer, some symptoms are warning signs of a serious condition. Your healthcare team considers these signs and symptoms an emergency. This means you must take action right away. Call 911 right away if your child is not breathing or has severe trouble breathing, has skin or lips that look blue, is having a seizure and you have not been told to manage these at home, or does not wake up after you have tried to wake them up. Call your healthcare team right away if your child has an oral temperature of 100.5 degrees Fahrenheit, 38 degrees Celsius, or higher, chills, or sweating. If your child has any of these symptoms, do not take any medicine to reduce the fever unless instructed by your child's healthcare team. Do not wait for your child's temperature to rise. Been unable to drink or keep fluids down for 6 hours. Nausea or vomiting that cannot be stopped with medicine. Diarrhea of more than 4 loose stools in 8 hours, or constipation for more than 3 days. Shortness of breath, trouble breathing, or persistent cough. Unusually tired, weak, or irritable. Bleeding, nosebleeds, bruises, or small red dots under the skin. Blood in the urine or stool. Pain or burning feeling while urinating. Uncontrolled pain. Open sores on the lips, tongue, or gums, or near the rectal area. If your child has a VP shunt and experiences sudden headache, nausea, vomiting, change in activity or level of consciousness. Any other new symptoms your child has not had before. Call the Robin Bush Child and Adolescent Clinic at 713-792-6610, Monday through Friday, 8 a.m. to 5 p.m. if you need to speak with your child's healthcare team. After hours, on weekends and holidays, call the George E. Foreman Pediatric and Adolescent Inpatient Unit at 713-792-5173 or 713-792-5149 to speak with the on-call healthcare team. For urgent care and treatment, bring your child to the Robin Bush Child and Adolescent Clinic Triage, Monday through Friday, 8 a.m. to 5 p.m. After hours, weekends, and holidays, go to the MD Anderson Emergency Center. If you are more than 30 minutes away from MD Anderson, go to the nearest emergency center. Let the providers know that your child is being treated at MD Anderson and cannot wait in an area with other patients who may be sick. Also, let them know what kind of cancer your child has, the date of the last treatment, and your child's most recent blood count results. Please talk with your healthcare team if you have any questions about your child's care or need more information.